From December 31, 2019 to January 3, 2020, a total of 44 cases of pneumonia of unknown causes were reported to WHO by the Chinese authorities. On 11 January, WHO received further information from the Chinese National Health Commission that the outbreak is associated with exposures in one seafood market in Wuhan, and that the Chinese authorities had identified a new type of coronavirus, which was isolated on 7 January. During the early stages of the outbreak, the number of cases doubled approximately every 7.5 days. In early and mid-January, the virus spread to other Chinese provinces, helped by the Chinese New Year migration and Wuhan being a transport hub and major rail interchange. On 10 January, the SARS-CoV-2 genetic sequence data was shared through GISAID. On 20 January, China reported nearly 140 new cases in one day, including 2 people in Beijing and 1 in Xinjiang. A retrospective official study published in March found that 6,174 people had already developed symptoms by 20 January, most of them would be diagnosed later, and more may have been infected. A report in The Lancet on 24 January indicated human transmission, strongly recommended personal protective equipment for health workers, and said testing for the virus was essential due to its pandemic potential. On 31 January, The Lancet would publish the first modeling study explicitly warning of inevitable independent self-sustaining outbreaks in major cities globally and calling for large-scale public health interventions. On 30 January, with 7,818 confirmed cases across 19 countries, the WHO declared the COVID-19 outbreak a public health emergency of international concern, (FEIC), and then a pandemic on March 11, 2020 as Italy, Iran, South Korea, and Japan reported increasing numbers of cases. On 31 January, Italy had its first confirmed cases, 2 tourists from China. On 19 March, Italy overtook China as the country with the most reported deaths. By 26 March, the United States had overtaken China and Italy with the highest number of confirmed cases in the world. Research on SARS-CoV-2 genomes indicates the majority of COVID-19 cases in New York came from European travelers, rather than directly from China or any other Asian country. Retesting of prior samples found a person in France who had the virus on December 27, 2019 and a person in the United States who died from the disease on February 6, 2020. On 11 June, after 55 days without a locally transmitted case being officially reported, the city of Beijing reported a single COVID-19 case, followed by 2 more cases on 12 June. As of June 15, 2020, 79 cases were officially confirmed. Most of these patients went to Xinfadi Wholesale Market.On. On 29 June, WHO warned that the spread of the virus was still accelerating as countries reopened their economies, despite many countries having made progress in slowing down the spread. On 15 July, 1 COVID-19 case was officially reported in Dalian in more than 3 months. The patient did not travel outside the city in the 14 days before developing symptoms, nor did he have contact with people from areas of attention. In October, the WHO stated, at a special meeting of WHO leaders, that 1 in 10 people around the world may have been infected with COVID-19. At the time, that translated to 780 million people being infected, while only 35 million infections had been confirmed. In early November, Denmark reported on an outbreak of a unique mutated variant being transmitted to humans from minks in its North Jutland region. All 12 human cases of the mutated variant were identified in September 2020. The WHO released a report saying the variant had a combination of mutations or changes that have not been previously observed. In response, Prime Minister Mette Frederiksen ordered for the country, the world's largest producer of mink fur, to cull its mink population by as many as 17 million. On 9 November, Pfizer released their trial results for a candidate vaccine, showing that it is 90% effective against the virus. Later that day, Novavax entered an FDA Fast Track application for their vaccine. Virologist and U.S. National Institute of Allergy and Infectious Diseases Director Anthony Fauci indicated that the Pfizer vaccine targets the spike protein used to infect cells by the virus. Some issues left to be answered are how long the vaccine offers protection, and if it offers the same level of protection to all ages. Initial doses will likely go to healthcare workers on the front lines. On November 9, 2020, the United States surpassed 10 million confirmed cases of COVID-19, making it the country with the most cases worldwide by a large margin. It was reported on 27 November, that a publication released by the Centers for Disease Control and Prevention indicated that the number of viral infections are via confirmed laboratory test only. However, the true number could be about 8 times the reported number. The report further indicated that the true number of virus-infected cases could be around 100 million in the US. On 14th of December, Public Health England reported a new variant had been discovered in the southeast of England, predominantly in Kent. The variant, named Variant of Concern 200-2012-01, showed changes to the spike protein which could make the virus more infectious. As of 13th of December, there were 1,108 cases identified. Many countries halted all flights so far.